Hi everyone, it's your girl, Sharonda Standing Strong. So, I just wanted to talk today. I'm in a little pain. I'm dealing with this carpal tunnel. I don't know if it's carpal tunnel syndrome or what it is, but y'all, it is giving me so much pain. So the first time I ever encountered it was in 1995. Kind of let you guys know how old I am in case you haven't seen that video on my birthday this year. But yeah, so I first started dealing with it back then. The first job I had was like a little strenuous type job, and I was using my hands repetitively over and over and over and over. I worked at that job for almost 3 years, 2.5, almost 3 years. And so when I left that job, it kind of like the pain kind of like eased away, went away, and it never surfaced again. But then, in the process of me doing hair, because when I was 15, my mom taught me how to do my own hair. I was born to a mother who was sick, and she knew that one day she wouldn't be here. So at the age of 15, she stood me in the mirror and she taught me how to do hair, how to braid my own hair with weave extensions. And so at the age of 15, I started doing everybody hair. So in between working at a young age and doing hair, I think it kind of like did something to my hand. So after that first job, I went to the second job that I got, and it really didn't bother me then. So as the years progressed and stuff, I went to this other job. It was like jobs that had to do a lot of strenuous things with your hands, power tools or something like that was like causing a lot of nerve damage or stimulation, and it was like doing something to my hands. So as time progressed or whatever, it went away. So I started this new job. I've been here for a month now. I'm pretty sure you guys have seen the videos that I've posted in reference to my new job. So I've been here for a month, and the second week of me being there, I started getting these pains and stuff, and my hands all over again. And it is like excruciating because every day I'm constantly using my hands, doing the same things repetitively over and over and over and over. Yes, every day in life we use our hands, but this is more strenuous stuff that I'm doing. And so Friday night, I could not sleep at all. I barely got any sleep. When I tell y'all this pain has been kicking my butt, it has been kicking my butt. So I was crying, like holding my hands. I've been using the Advil targeted relief cream that was doing nothing. I even got the Tylenol arthritis pills that was doing nothing. I put cold compress ice packs, nothing. Warm things on my arm, nothing. So the tingling was like excruciating pain. I was just rubbing my hand, my arm, crying tears, y'all, Friday night because it was so much. So finally, I think I ended up falling asleep at like 5 o'clock in the morning because my goal was to be at First Health at 8:30 Saturday morning because I had to get this looked into. I was trying to wait because I have a primary care visit with my doctor in December. But I was like, I cannot put this off any longer. And I ended up getting to the doctor at like 9:30. They were so backed up. My appointment time was 12:45. She said, you can go home and come back. I was like, no, ma'am. I sat there on yesterday morning, Saturday, from 9:30 until my appointment time, 12:45. But they were so backed up with so many people that I actually did not get seen till 1:30. So from 9:30 to 1:30, I'm sitting there, I'm texting one of my friends, and she dealing with the toothache, and I'm dealing with my hand aching, and I'm like, girl, I can't text a whole lot because my hands are in pain. So when I did get to the back or whatever, I had my upper respiratory sinus issues going on, so she dealt with that, and then we was talking about my hand, and she looked at my hand and stuff. And she made me a referral to the doctor to get my hand and stuff checked because she said it could be something other than carpal tunnel, but they'll do a bunch of x-rays and stuff like that to make sure that's exactly what it is. And she was like telling me the different things that could possibly happen. Well, the doctor and the nurse, because the nurse told me that she had it and she put it off as long as she could, but in her process of putting it off, she actually made it worse for her. And she told me if she could tell me anything, she would tell me not to put it off, to get it checked. And so I said, it's at the point where the pain that I'm having, I can't put it off. I got to get it checked and taken care of. So she was like telling me that that they may do like a steroid injection or whatever, or they may have to do surgery, go in and pop the vein, something that's causing pressure or something, she said. But so I was given a muscle relaxer prescription, 500 milligrams, and it is working. It has taken the severe pain away. It has eased the pain, but I can only take them at night because they cause you to be drowsy and sleepy, and I can't take them during the daytime because I have to work or whatever. So today I could have gone to the place that the doctor sent my referral to. It's all in the network of where my other doctors and stuff are up under First Health. I could have gone there today to their walk-in clinic, but she said that the referral wouldn't be seen until Monday. So I said, well, I'm going to give this muscle relaxer a try. It has been helping. It has eased the pain, but the pain is still there. So I'm going to give them until tomorrow to get my referral and wait for them to give me a call, or I'm going to call them tomorrow after work. And I know that the place is open on the weekends now. She said the weekend really isn't busy because that many people don't know that they have weekend hours. So depending on what time slot they try to give me so that I don't have to miss work during the week, I may go Saturday or Sunday. But if you guys have been dealing with this, I know one of the content creators, we follow one another, and she did comment on my post that she has dealt with it. So if this is something that you guys have been dealing with or have dealt with, please let me know in the comments. Give me some advice on what I can do until I get my doctor's appointment to help ease this pain, because your girl was going through Friday night crying like a baby. But yeah, please drop down in the comments if you made it this far in the video, and let me know if you've ever dealt with carpal tunnel, and what were some of the things that you did to get through the pain and the process, because I do not want to have surgery. That's the last thing on the list. That is the very last thing, but it's both my hands. My right hand is the more dominant one that I write with, but the pain is more severe in the left hand. But I don't want to have surgery on either one of them if I can prevent that from happening. So let me know in the comments some of the things that you did, some of the things I could do to help ease the pain. And I thank you guys for your advice and your comments. Have a blessed day.